Alright, so we talked about the fluid balance control. So if we're going to get too much fluid, then we're going to have an excess volume of fluid. So with that, it's going to occur in the extracellular compartment. So that's going to be like the fluid outside of the cell. And it's also with the osmolarity of the solute in the fluid, it affects the shifts between the compartments. So having too much of the fluid can prevent more fluid from coming in. So the causes and that will lead us to edema, fluid volume excess or whatever is going to be edema. So the causes are going to be an increase in capillary hydrostatic pressure. So that means that fluid cannot return to the interstitial fluid. It can't return inside. And then also a loss of plasma proteins. So this allows more fluid to go out, but it won't let fluid come back in, because if we have a loss of those proteins, we can't allow more fluid to come back in. And then also an obstruction of the lymphatic circulation. So that means down here I wrote fluid and protein cannot return to general circulation. So that means we won't be able to get the water, we won't be able to get the protein back into where we need it to get into the normal circulation. And then we also have an increase in capillary permeability, which that is just going to be your inflammation response or just a sign that you have an infection. So with all these causes, it leads us to all these different kinds of effects in light blue. I didn't have enough room, so I wrote one over here. So we'll just go ahead and get this one out of the way. So the edema in your skin can lead to tissue breakdown from the pressure, because you have so much fluid on the outside, like on the outside of your cells. And just go ahead and chew your carrot. Chew your carrot.
Getting my fluids in.
So with having so much pressure, it can cause different tissues to start to break down. And then we can have some swelling within the local area, so it doesn't have to be in just the whole body. It can be in just one part of your body. And that skin near it or on it will be pale or red. And then we can get pitting edema, which is when like you would push something. Like if I had the swelling in my hand and I were to push on it, the pit would still remain. So it's like a depression. The pit would still remain once my finger is removed. And then we will also have an increase in body weight. That's normally with generalized edema. So because you have all that extra fluid on you, you're gonna gain more weight. And then you can have functional impairment, which is a decrease in your vital capacity, and it restricts the movement of your joints. So if you're having too much fluid, you may not be able to move as well or at all, because you have so much swelling and so much fluid within you. And then it can cause pain, which that is going to put pressure on your nerves and can cause like the headaches, or it could even cause a seizure if you have so much pressure on those nerves. And then it can impair your arterial circulation, so it can lead to ischemia, which can cause that tissue breakdown, which we also talked about here. And then it can also affect your dental, your oral cavity, because of the swelling, it can cause your gums to swell as well. So with that, older people may not be able to put dentures in. So or if a child or a younger person were to get it, say they were going to get impressions for braces, retainer, whatever, they won't be able to get those impressions because of all the swelling. So thanks for listening, and stick with us for the fluid deficit.